Hello friends, let us start today's lecture about hypothyroidism. The name itself suggests that in this disease there is decreased secretion of thyroid hormones. Let us start with two clinical scenarios. The first one is 23-year-old Hannah who complains of lethargy, fatigue, reduced appetite, muscle weakness and constipation. She also says that lately she gained a bit of weight and also has a low libido. On clinical examination, she has periorbital edema, dry cool skin, her nails are brittle and her reflexes are slow. She also has a moderately enlarged, painless goiter. The other one is 33-year-old Ramesh who also presents with lethargy, fatigue, reduced appetite, muscle weakness, constipation, and he is also complaining about feeling cold all the time. He said that he recently had the flu but no other illnesses. On clinical examination, there is periorbital edema, dry cool skin, brittle nails and hair, and a very painful goiter. Thyroid stimulating hormone, that is TSH, free T3 and T4 are taken along with anti-thyroid peroxidase and anti-thyroglobulin antibodies. It was found that both Hannah and Ramesh have high levels of thyroid stimulating hormone and low T3 and T4 levels. But Hannah has positive anti-thyroid peroxidase and anti-thyroglobulin antibodies. So here we see that this both cases are about hypothyroidism. Then what makes them different? ये आपको हमारे आगे के लेक्चर में समझ में आएगा. Let's start. Now let's start with some physiology of thyroid hormone release. नॉर्मली क्या होता है, जो हाइपोथैलेमस है वो डिटेक्ट करता है कि अगर हमारे सीरम में लो लेवल ऑफ थायराइड हार्मोन है तो वो एक प्रोटीन रिलीज करता है जिसे कहते हैं थायरोट्रोपिन रिलीजिंग हार्मोन इनटू द हाइपोफिशियल पोर्टल सिस्टम. नाउ इन रिस्पॉन्स टू दिस TRH और थायरोट्रोपिन रिलीजिंग हार्मोन जो हमारी एंटीरियर पिट्यूटरी है वो देन रिलीज करती है थायराइड स्टिमुलेटिंग हार्मोन जिसे थायरोट्रोपिन भी कहा जाता है या फिर सिंपली TSH भी बोलते हैं. TSH जो होता है देन वो स्टिमुलेट करता है थायराइड ग्लैंड को. Now the thyroid gland is made up of thousands of follicles which are small spheres which are lined by the follicular cells. जो फॉलिकुलर सेल्स है वो कन्वर्ट करते हैं थायरोग्लोबुलिन जो कि एक प्रोटीन होता है फॉलिकल्स में इनटू टू आयोडीन कंटेनिंग हार्मोन्स. फर्स्ट इज T3 और ट्राई आयोडोथायरोनिन एंड नेक्स्ट वन इज T4 और थायरोक्सिन. सो इन समरी जो थायराइड रिलीजिंग हार्मोन होता है दैट स्टिमुलेट द सिक्रीशन ऑफ थायराइड स्टिमुलेटिंग हार्मोन फ्रॉम द एंटीरियर पिट्यूटरी and then it finally then stimulate the thyroid gland to secrete T3 and T4. Once T3 and T4 is released, they get into the blood and they bind to the circulating plasma proteins. Only a very small amount of T3 and T4 remains unbound or free, जो कि हर टाइप के सेल में जाकर एक्ट कर सकते हैं. And once T4 is inside the cell, it gets converted into T3 with the help of two enzymes called deiodinases. Here there is one point to be noted that जो हार्मोन थायराइड ग्लैंड से ज्यादा रिलीज होता है वो है थायरोक्सिन और T4. देन T4 सेल्स में जाके कन्वर्ट होता है इनटू T3. T3 भी रिलीज होता है थायराइड ग्लैंड से बट बहुत ही स्मॉल अमाउंट में. T4 इज द मैक्सिमम हार्मोन विच इज रिलीज फ्रॉम द थायराइड ग्लैंड एंड जो T4 होता है वो सेल में जाके देन कन्वर्ट होता है इनटू T3 एंड जो बेसल मेटाबॉलिक रेट होता है उसको T3 ही इफेक्ट करता है. सो T3 is actually responsible to carrying out the function of speeding up the cell's basal metabolic rate. So this picture demonstrates the histology of the thyroid gland. Here we can see the thyroid follicles lined with follicular cells and in the center it is filled with colloid which is the fluid that is contained inside the thyroid follicle. Then we can also see the parafollicular cells which is also known as C cells as they release calcitonin. We can see the capillaries and also the outermost portion which is the capsule that is made up of connective tissue. Now let us review some normal function of thyroid hormone. The thyroid hormone increases the cardiac output, it stimulates the bone resorption, basically means that it thins out the bone, and it also activates the sympathetic nervous system. It is also responsible and is involved in a number of other things, like it controls the sebaceous or the oil glands and the sweat gland secretions. It also is responsible for the hair follicle growth, and it regulates protein and mucopolysaccharide synthesis through the skin fibroblasts. Types of hypothyroidism. There are three basic types of hypothyroidism. The first being primary, the second one is secondary, and the third being the tertiary. They all result in decrease in thyroid hormone. But in primary, there is destruction to the thyroid gland, whereas in secondary there is damage to the pituitary, and in the tertiary there is damage to the hypothalamus. In primary, due to damage to thyroid gland, there is no T3 or T4. Whereas in secondary, due to damage of pituitary, there is no TSH, and therefore there is no T3 or T4. And in the case of tertiary, there is no TRH, thyrotropin releasing hormone, because of damage to the hypothalamus. This results in no TSH secretion and further no T3 or T4 release, all leading to hypothyroidism. Now, the secondary and tertiary hypothyroidism are also sometimes together known as central hypothyroidism. How to differentiate between primary and central hypothyroidism? This is very important. So, in the case of primary hypothyroidism, there is lack of T3 and T4 with increased level of TSH from the pituitary, because the pituitary tries to stimulate the thyroid gland. Whereas in the case of central hypothyroidism, there is decrease in T3 and T4 with decrease in TSH release. Because in the case of central, either pituitary is damaged, leading to decreased level of TSH, or either hypothalamus is damaged, leading to decreased level of TRH, further leading to decreased level of TSH. So it is important that in primary there is lack of T3 and T4 with increased levels of TSH, whereas in central there is lack of T3 and T4 with decrease in TSH. Please remember this, because this is a high yield fact for your examinations. Symptoms of hypothyroidism. The metabolic findings include weight gain, cold intolerance due to low basal metabolic rate. The skin and the hair findings include cool skin due to vasoconstriction, dry skin due to decreased secretion of the sweat glands and sebaceous gland. The hair is coarse and brittle, and there can be diffuse alopecia. Alopecia is hair loss, so there can be diffuse hair loss. And the nails are also brittle. Brittle is kamzor or najuk. So hypothyroidism also leads to increase in glycosaminoglycans. This point is very important. Please remember this, that this hypothyroidism leads to an increase in glycosaminoglycans in the interstitium, because it elevates the osmotic pressure and it leads to water retention that eventually cause non-pitting edema. As a result of all this, the individual can suffer from a puffy face, puffy appearance, which is also called as myxedema. Ocular findings include periorbital edema. In this situation, the regions around the eye gets swollen due to excess of water retention. Now, the gastrointestinal findings include constipation due to low GI motility, and there is also reduced appetite. The musculoskeletal findings include hypothyroid myopathy, that which presents with muscle weakness, especially the proximal muscle weakness. Sometimes there can also be muscle damage, and because of this there can be seen increased creatinine kinase levels. It's not exactly understood why this happens, but it's known that the thyroid hormones have a great influence on cell metabolism, including the metabolism of the muscle cells. Sometimes it can also lead to carpal tunnel syndrome, as it is thought that this happens due to accumulation of glycosaminoglycans. The other symptoms of hypothyroidism includes myoedema. Now, what is this term myoedema? It is actually the formation of a bump like this, that is caused by local muscle contraction when it is triggered by light percussion with an object. The prolonged muscle contraction is due to alterations in muscle fibers that has been caused by hypothyroidism. Now, the reproductive findings include menorrhagia, oligomenorrhea, low libido in females, and even infertility. These changes can occur due to deficiency in LH secretion or luteinizing hormone secretion. Now, the neuropsychiatric findings include hypoactivity, lethargy, fatigue, weakness, depressed mood, and slower reflexes. Finally, cardiovascular findings include bradycardia, low cardiac output, and dyspnea after exercising. Now let us see the causes of hypothyroidism. We have seen that there is two major classes of hypothyroidism, the primary and the central. So the causes of primary hypothyroidism is Hashimoto's thyroiditis, postpartum thyroiditis, de Quervain thyroiditis, Riedel thyroiditis, congenital hypothyroidism, iodine deficiency, Wolff-Chaikoff effect, and the drugs like amiodarone and lithium. Now we will study about each one of them one by one in our upcoming slides. Now, in the causes of central hypothyroidism, it is very simple that the secondary one is as due to damage in the anterior pituitary, so it can be due to tumor or it can be due to infection that damage the gland and prevents the TSH production. In the case of tertiary, it is due to damage to hypothalamus, so it can be due to trauma, lesion, or anything that suppresses the secretion of the thyrotropin releasing hormone. Hashimoto's thyroiditis. It is also known as chronic autoimmune thyroiditis. It is the most common cause of primary hypothyroidism in the countries that have sufficient amount of iodine in their food. This is an autoimmune disorder where the T cells and the autoantibodies like antithyroid peroxidase and thyroglobulin antibodies, they infiltrate the thyroid. So basically in this disease we see that there is production of autoantibodies. There are such antibodies that attack the cells of our own body, like in this case they attack the enzyme of the thyroid gland, the thyroid peroxidase enzyme, and the antibody known as anti-thyroid peroxidase, and also they also attack thyroglobulin, and so the other antibody named as thyroglobulin antibodies. Now there is a gene complex involved in the regulation of immune response, and this is called the human leukocyte antigen system or HLA system. HLAs are actually the markers of the cell, markers that like differentiate between the cell of one human being to the other. So it is found that individuals with Hashimoto thyroiditis often have a specific HLA gene that is associated with it, and the HLA gene that is associated is HLA-DR3 or HLA-DR5. This you will study in immuno section. Findings in Hashimoto's thyroiditis. We see that the thyroid gland becomes enlarged. It is non-tender, and most importantly, they do not cause pain. In individuals with Hashimoto thyroiditis, it has been seen that there is a higher risk for developing lymphoma, and this disease proceeds by transient hyperthyroid state. It means कि first we see there is hyperthyroidism and after that we see there is hypothyroidism. अब ये होता क्यों है? Because firstly autoimmune damage को मेंटेन या लेवल अप करने के लिए जो थायराइड सेल्स होती है वो अपने साइज को इंक्रीज कर लेती है और अपने नंबर में भी इंक्रीज करती है एंड दिस ड्यू टू दिस फर्स्ट हमें हाइपरथायरॉयडिज्म देखने को मिलता है. बट धीरे धीरे जो ऑटो इम्यून सेल्स जो ऑटो एंटीबॉडीज होती है दे डैमेज द होल स्ट्रक्चर द होल थायराइड टुगेदर and this leads to then hypothyroidism. So it is important then in the Hashimoto thyroiditis we see a transient hyperthyroid state. Histology of Hashimoto's thyroiditis. So on histology we see that there is presence of Hypothyroid cells in the cases of Hashimoto's thyroiditis. So what is Hypothyroid cells? They are actually the cells that has a different look than the thyroid tissue. It is bigger and it is bigger than a follicular cell and has pink staining cellular material. We also say that it has eosinophilic cytoplasm and due to this it is also known as pink staining oncocytic. Why oncocytic? Because it has vesicular nucleus with a large nucleolus. Also in the histology there can be seen lymphoid aggregates with germinal centers. Now let us study about postpartum thyroiditis. It's a variant of Hashimoto's thyroiditis that is seen after childbirth. It is a self-limited thyroiditis that resolves by itself and it can happen up to 1 year after delivery. इसका cause कोई known नहीं है but इसे autoimmune ही consider करते हैं. इसका mechanism क्या है कि जो developing fetus होता है वो actually mother में immune response को एक्टिवेट कर सकता है बट प्लासेंटा की वजह से वो सप्रेस्ड रहता है ड्यूरिंग द प्रेगनेंसी. पर एक बार डिलीवरी होने के बाद क्योंकि प्लासेंटा नहीं रहता सो ये जो इम्यून सप्रेशन जो होता था वो चला जाता है. तो जो एंटी थायराइड बॉडीज होती है फ्रॉम द फीटस इट कैन अटैक द मदर थायराइड लीडिंग टू पोस्टपार्टम थायराइडिटिस. एंड इसके जो क्लिनिकल प्रेजेंटेशंस होते हैं इट कैन बी डिफरेंट एंड इट कैन वेरी एज ट्रांजिएंट हाइपरथायरॉयडिज्म जो कि हम हाशिमोटोस थायरॉयडिटीज में भी देखते हैं और इट कैन बी हाइपोथायरॉयडिज्म और हाइपरथायरॉयडिज्म फॉलोड बाय परमानेंट हाइपोथायरॉयडिज्म. इन शॉर्ट इतना कंफ्यूज होने की जरूरत नहीं है. इट्स जस्ट दैट या तो ये ट्रांसिएंट हाइपरथायरॉयडिज्म का स्टेज शो कर सकते हैं द केस एज इन सीन इन द केस ऑफ हाशिमोटोस थायरॉयडिटीज या फिर नॉर्मली अगर इसको डिफरेंशिएट करना होता है तो एग्जाम्स में ऐसा दिया रहता है कि इस पोस्टमार्टम थायरॉयडिटीज की वजह से परमानेंटली ही पेशेंट को हाइपोथायरॉयडिज्म हो जाता है. On histology, there is a lymphocytic infiltrate with occasional germinal center formation. Histology तो mostly Hashimoto से same ही होती है. Next is subacute granulomatous thyroiditis, also called as D-Quervain thyroiditis. It is also a self-limited condition जो कि अपने आप ही ठीक हो जाता है और ये जो है it's very much important that it often follows a flu-like illness such as a viral infection. Usually we see that the patients suffering from subacute granulomatous thyroiditis have a past history of being suffered from an upper respiratory tract infection. This is an inflammatory condition where the follicular cells are being damaged by inflammation. एंड इसके जो अपीयरेंस होती है 3 फेज में होती है. फर्स्ट देयर इज हाइपरथायरॉयडिज्म ड्यू टू एक्स्ट्रा थायराइड हार्मोन्स रिलीज बाय द डैमेज फॉलिकल्स फॉलोड बाय हाइपोथायरॉयडिज्म एंड देन रिटर्निंग टू द नॉर्मल थायराइड फंक्शन. So पहले hyper, then hypo, then normal. And histology, in the early phases there are neutrophils and destruction of follicles with colloid depletion. Later on granuloma जो वो form हो जाता है surrounding the follicles. On clinical examination there is jaw pain and thyroid is very tender. So first difference we can see between the Hashimoto and subacute, that the thyroid is tender. And of course it is very much important, means very much important, that it causes painful goiter. Unlike Hashimoto or riddle thyroiditis, only the subacute granulomatous thyroiditis cause painful goiter. इसके लिए एक mnemonic जैसा भी है, where it is said that D-Quervain brings the pain. मतलब Quervain brings the pain. ओके ये जो लास्ट वर्ड्स है ना AIN Quervain के, उसको पेन के साथ रिदम करते हैं. So it's important, please remember. And the labs in the case of subacute granulomatous will show high ESR, that is erythrocyte sedimentation rate. In this picture, we can see the granulomatous inflammation caused by subacute granulomatous thyroiditis. Next is RIEDEL'S thyroiditis, which is also called invasive fibrous thyroiditis. It is a chronic inflammatory condition in which the thyroid tissue is replaced by fibrous tissue with inflammatory infiltrate. Although the real cause of Riedel thyroiditis is unknown, it is believed that it is somewhere related to systemic conditions that affect immunoglobulin G4. This point is really important, that it is related to systemic conditions that affect immunoglobulin G4. So, and such diseases which are linked to it are autoimmune pancreatitis, retroperitoneal fibrosis, and non-infectious aortitis. Only 1/3 of individuals suffering from Riedel thyroiditis are hypothyroid. The most important complication of this thyroiditis is that as there is fibrosis of the thyroid gland, the fibrosis can also sometimes extend to local structures like the trachea and the esophagus due to extension, and because of this peculiarity, it is sometimes mistaken for anaplastic carcinoma. On the clinical examination, there is fixed, hard and painless goiter. Now this is the picture demonstrating the histology of Riedel thyroiditis. In this picture we can see that how the thyroid is replaced by fibrous tissue and the inflammatory infiltrates. Now we'll study about congenital hypothyroidism. It is also called as cretinism. This condition only affects newborn. It is actually caused by antibody mediated maternal hypothyroidism, which is when the maternal antibodies destroy the newborn's thyroid. Other causes can also be thyroid agenesis, in which the thyroid gland doesn't form, or thyroid dysgenesis, in which the thyroid gland is formed but is formed abnormally. This is the most common cause of cretinism in the US. So thyroid dysgenesis is the most common cause of cretinism in US, where the thyroid gland is formed but abnormally. Finally, it can be caused also by iodine deficiency or by dysharmogenetic goiter, in which there is a lack of enzyme for the synthesis of thyroid hormones. Remember that some of the mother's thyroid hormones are passed on to the baby, so symptoms will only manifest after these hormones are gone. Now the symptoms of congenital hypothyroidism can be learnt as 6 P's. The 6 P's, where the first P stands for pot-bellied, The second is pale. Third is puffy faced. Fourth is protruding umbilicus. Fifth is protuberant tongue. And sixth and the last is poor brain development. In this slide, there are some pictures demonstrating some of the symptoms of the congenital hypothyroidism. In the first picture, we can see the symptom of the pot-bellied. Then in the second picture, we can see the puffy faces. Also in the third picture, and also the protuberant tongue. Now let us study the other causes of primary hypothyroidism. The first one is iodine deficiency, which is most commonly seen in countries where there is deficiency of iodine in food. Another cause is Wolff-Chaikoff effect, which is an autoregulatory phenomenon. In this phenomenon, with too much of iodine, the thyroid responds by inhibiting the synthesis of thyroid hormone in order to avoid producing too many hormones. But this doesn't last forever, and eventually the thyroid will escape and resume the thyroid hormone production. Now the other cause also include medications like amiodarone, lithium and sulfonamides that decrease thyroid hormone synthesis. Now how to diagnose hypothyroidism? It is done by measuring blood levels of TSH, T3 and T4. In all cases, thyroid hormones will be low, but TSH levels vary. If it's due to a primary cause, TSH will be high, and if it's due to secondary cause, TSH will either be low or normal. This we have studied earlier also. There can also be hypercholesterolemia due to low LDL receptor expression. Treatment for all types of hypothyroidism is thyroid hormone replacement therapy. Primarily used is levothyroxine, which is a synthetic T4 or thyroxine. Okay, back to our case. In this we have seen that both Hana and Ramesh were suffering from hypothyroidism, but I said you that there is difference between both of the case. What was the difference? As we can see that in the case of Hana, there was enlarged and painless goiter. Okay, and also in the case of Hana, the laboratory findings showed positive anti-thyroid peroxidase and anti-thyroglobulin antibodies. So, what kind of thyroiditis was Hana suffering from? Just from seeing the description of painless goiter and the presence of positive anti-thyroid peroxidase and anti-thyroglobulin antibodies, it is enough to diagnose that the Hana was suffering from Hashimoto's thyroiditis. Whereas the Ramesh, who presents with I think painful goiter, and also in the history he suffered from flu. Can you tell me which type of thyroiditis does Ramesh presents with? Please comment this in the comment section below. As the video is getting longer, so the clinical scenarios and some questions related to this topic will do it in next to next video when we'll study about hypo versus hyperthyroidism. For today, thanks for watching. If you feel my videos are useful, then please don't forget to like, share and subscribe. Do press the bell icon for more updates.